Live from the new Health and Science Building at Central Wyoming College in Riverton, Wyoming PBS presents Wyoming Perspectives, Health Exchange User Guide. Hello, I'm Richard Ager. Welcome to this hour-long program, which is dedicated to explaining some of the basics on how the health insurance marketplace is changing on October the 1st. We'll be taking your questions at 1-800-495-9788 or send them to me at richard@wyomingpbs.org. You can also tweet us at #WyoHealth. A few basics before we start. About half of us get our insurance through an employer, and a third through government programs. The health insurance exchange we're talking about is really intended for the 1 in 10 who buy their own. So if you already have insurance through an employer, you could probably make some popcorn and watch your Downton Abbey DVD. But if you or someone you know is uninsured or underinsured, then stay with us. And joining me in the studio, we have Mike Fireberg from the Denver Regional Office of the Centers for Medicare and Medicaid Services. His agency is lucky enough to be responsible for administering federal insurance exchanges in states that decline to set up their own, such as Wyoming. Also, Carla Borders from Wyoming Senior Citizens, Inc. She is one of the navigators who have been trained to tell and train people on what kind of health coverage is most appropriate for their needs. Also joining us, Danielle Allred. She is an outreach and enrollment specialist for the Migrant Health Program in Powell. And finally, Representative Kathy Coleman from Sheridan. She's a member of the Wyoming Legislature's Select Committee on Health Benefit Exchanges and the Labor, Health, and Social Services Committee. Welcome, all of you. That's the longest introduction I've ever done. As we look ahead next Tuesday when the exchanges open up, the marketplaces open up, give me a quick sense, Mike, of what you're expecting.
That's a little hard to say because we've never done this before. We do know that there's a lot of pent-up demand because there are so many people in Wyoming and across the country who are uninsured and underinsured. And those are the people, as you mentioned, for whom the marketplace is primarily intended. People who don't have insurance, maybe never even thought about it, maybe don't even have any clue of how health insurance works. People who have tried to get the individual policies but found that they were way too expensive, or worse, they couldn't get one at all because they have a pre-existing condition. Okay, you know, almost 500,000 people in this state have pre-existing conditions.
In just a moment.
Well, that's who it's for, and those are the people we think are probably going to jump in early.
In a sense, the neediest.
Yes, the people for whom the marketplace really brings the greatest benefit.
Carla, as a navigator, have you already started hearing from those people?
I have heard from a few people. We've arranged some town hall meetings and did a seminar earlier today. So it's starting to happen. Not sure what to expect on Tuesday, but I'm sure the phone will be ringing.
Now, I know that Danielle, as a navigator, but for, I think, possibly a different cohort of the population, who have you heard from so far, and who do you think you're going to be hearing from?
Well, I'm along the same lines as Carla, just the people who are the neediest for it. Mainly right now I'm focusing on my outreach work to get my name and what I can do for you out there. Because a lot of people don't know what the marketplace is yet or what they can benefit from it. So as of right now, I'm just trying to inform people of that, and then they can come to me and I can help them enroll in the marketplace.
Now, Representative Coleman, I had a feeling your committee is not going to be having a party on Tuesday, but I was just wondering, do you expect a sort of a slow ramp up, or do you think this is going to be, a lot of people off the top?
I'm not sure if there's ever going to be a huge surge of individuals that are going to the exchange to purchase their insurance. I think it'll be a little bit at a time, and I really think our navigators have their work cut out for them because although Tuesday may come and go without a lot of individuals actually going onto the exchange and utilizing that. I really think that it's going to take a lot more outreach, and these girls have a lot of work to do.
Definitely, as with any major government program. Well, I think, just to cover some basics, it's fair to say this has been a long, tough fight just to get to where we are. The healthcare exchanges, when they open on Tuesday, and they'll run through the end of March, I wanted to start with a little explainer. So here's 30 seconds from Kaiser Family Health.
The health insurance marketplace is like a virtual insurance mega mall. Here you'll find private insurers competing for your business, and you'll be able to pick out how much coverage you want and how much you want to pay for it. From cheaper, high-deductible bronze plans to more expensive platinum plans. Still, all plans will cover a comprehensive set of services like hospital and doctor visits, maternity care, mental health care, and drugs. Most everything any of us need, at least when it comes to medical care.
Sounds pretty simple, just about everything that we need. You know, Mike, Federal Health and Human Services put out news releases today stating, and here's, I'm going to quote, Wyoming consumers will be able to choose from an average of 16 health plans in the marketplace. But that's not 16 companies. That's...
No, but 16 plans, the point is you'll have a choice, even if they're only from 2 or 3 companies, which I believe is the case. But even if you only have 2 or 3 companies, at least you'll have 16 different choices, which vary according to how much premiums are, what the deductibles are, and what the copays are, so that people will be able to choose what makes more sense for their needs and their expected use of the healthcare system. That's really important. A lot of people will just shop and buy the lowest premium. For a lot of people, that's a mistake, because a low premium usually means a high deductible and a lot of copays out of pocket if you're a heavy user of the healthcare system. It may not turn out to be the best choice.
So the old rule, get what you pay for. You know, Carla, you know, these have been sort of color-coded. They said they're bronze plans, silver plans, gold plans, and platinum plans, obviously from cheapest to most expensive. Mm-hmm. Where do you expect most people to fall in on that?
You know, that's a good question. I really don't have any expectation as of right now, not really hearing from anyone yet. This is all kind of new to all of us. And I know that the deductibles and, you know, like Mike said, it all varies on that. So it's really kind of hard to say at this point where people will fit in.
Do you think, Representative Coleman, that this is these plans are easy to understand, the way that it's being set out, that there's these levels of coverage and, you know, you pay for what you get, and it's, you know, sort of laid out that way?
Yeah, I don't think that there's going to be much confusion about the plans and what level you're getting. And I also want to remind, you know, the plans are also available outside of the exchange. So, and luckily for us in Wyoming, the insurance providers that are set up on the exchange in Wyoming are insurance providers that have been established in Wyoming for a long time, and we've done a lot of business with them. So I'm not too worried about there being mass confusion about major changes in the insurance policies that we have available. These are the same companies that have been serving us in Wyoming for a long time.
Yeah, I mean, we could say, I think it's not official, but you know, Blue Cross Blue Shield being one, and the other one is it's in Cheyenne. I can't remember the name of it right now. It's got Wyoming in the it's a smaller company, but at any rate.
I'm not at liberty to even talk about it till October 1st, and that's the truth.
But, you know, clearly, you know, when we compare them with other states have, you know, quite a bit more variety. And also, when you look at the rates that were expected to be the case for Wyoming, I'll give you an example here that, let's see, I believe that the average for a silver plan in another state was across the nation was about $325, and in Wyoming it's over $400. Do you expect that to be an issue, Danielle?
Well, as Carla was saying, I think people like us were hired so they don't just choose a plan with the cheapest premium because they think that'll be best for them because it's the cheapest. We are, in our training, we have learned to be completely unbiased when it comes to health insurance. We need to get with our clients and learn every need that they have medically and what their budget is for this kind of expense, and then determine a plan for them so it fits their medical needs and they can get every kind of care that they need within their budget. So, I mean, if that falls in the bronze, then that's great. If it happens to fall in the premium or in the platinum, then it just kind of depends on how they use the healthcare system.
Now, tell me a little bit about the subsidies that are available, because for a lot of families, up to, I believe it's 400% of the federal poverty level, there are some subsidies available. And I'm wondering how much help that would be for a family of, let's say, 4, with an income of $50,000.
Well, I think on the cost sharing reduction side, they would qualify for that. They did give us, when you give us your information, the healthcare will let us know which either tax break or the cost sharing reductions you qualify for. And it just kind of depends on your situation, but it will help out families from individuals to families up to, I believe it was 8. Like a parent and then 5 or 6 children. So,
Mike, how much of a help do you think this sliding scale is going to be?
It'll be a tremendous help, particularly here in Wyoming, where, as you said, the premiums tend to be a bit higher. The point here is if you go to the marketplace, but only if you go to the marketplace to get your insurance, you are probably going to be eligible for tax credits to reduce the cost of that premium. And the tax credit computation is very complex, and believe me, I will not take the whole hour to try to explain it. But it's designed, it is designed so that at a given income level, you are expected to pay a certain percentage of your income toward the cost of the policy. And that's the same in Wyoming as it is in Montana, as it is in Arizona, as it is in Florida. So that even if the premium is more in Wyoming, the amount you're going to be expected to pay as a family or as an individual is the same in every state. So if Wyoming's premiums are higher, then the tax credit is going to be higher. The other thing I want to observe here is that, yes, Wyoming premiums do tend to be higher than most other states, but it's also true that the Affordable Care Act has a provision in it that requires all insurance companies to spend at least 80% of every premium dollar on health care. Not administrative expenses, not profits, not sending everybody in the managerial suite on a junket to Jamaica. If they spend more than 20% on administrative costs, they have to send a rebate to all of their consumers. And that does really happen.
Yeah, that's how
Last year here in Wyoming, $1.5 million came back to people because insurance companies were charging too much.
Well, just as a reminder for our viewers, we're going to take your questions at 1-800-495-9788. You can also send them to me at richard@wyomingpbs.org, or you can tweet us at #WyoHealth. And we should remind people, too, that since we didn't set up a separate insurance exchange here, you have to go to
healthcare.gov. Or you can call us toll free 24 hours a day at 1-800-318-2596. Write it down, 1-800-318-2596. They're open 24/7 and they're there to help, and they really are well trained, just as our navigators and certified application counselors are very well trained to make sure that you get the help you need without any bias, without spin, without any opinion.
You're
Just
saying
fact.
it's a spin-free zone.
It is a
at
spin-free
the
zone, yes.
Centers for Medicare.
We try.
Well, Representative Coleman, you're not only, of course, a legislator, but you run a staffing service. Is that correct? Or a business
I
in
do.
Sheridan. Yeah. How do you count how many employees you have? Because we're getting into a little bit, of course, what's in it for employers? What responsibilities do employers have? And talk a little bit about that, if you would.
Okay, how do I count the number of employees? Well, I'm going to count the number of employees exactly how the federal government tells me I have to count them, with my full-time equivalents and the rules for my part-time equivalents, the number of hours that they work, and then I guess average on, because I have seasonal employees as well. And so for me, with a staffing company, my entire business is based on turnover. So where other companies are going to struggle with their turnover rates and how that's going to factor into their bigger picture, mine is probably 10 times that kind of factoring. So it's a lot of counting. It's going to be very complicated, I think.
A lot of interpretations?
A lot of interpretation, yes. There's a lot of room there for misinterpretation too. So I don't think it's going to be easy for me as a business owner, and I don't think it's going to be easy for anybody as a business owner. If you're a small business, maybe you can 5 or 6 employees and they're all full-time or are very part-time, maybe this is simple for you. But when you take a look at the formulas and the definitions that have been established for small businesses in determining those part-time equivalents and full-time equivalents, I myself don't find it easy. So it gets complicated.
Carla, are there navigators available for business people?
Absolutely. That's one of the things that we do. We also have offices in Casper and Cheyenne with trained navigators. And then we've also been working in conjunction with Enroll Wyoming, who is going to be having navigators to come out and hit some of the communities that don't have representation.
Well, it sounds like you should pay Kathy a visit here.
Maybe so.
That's my area. I don't think there's navigators in Sheridan, unfortunately.
Well, now we have a question that has come in from Steve in Lander, and he'd like the panel to answer some questions regarding a program he heard today. Will there be an expenditure of $97 million for advisors approved in each state? And are those advisors political appointees? Well, first I've heard of it.
First, I've heard of it too.
Actually, my
Richard,
impression was that
I'm not sure what he's asking
in
about.
fact, the amount of money being spent for outreach was actually quite low. I think something about $67 million for the whole country.
That's the approximate amount of money that we gave in grants to the navigators in the federally run states, including Wyoming, collectively. Yes, we gave far more than that in terms of grants to the states which did choose to operate their own marketplaces. For example, Colorado. They got grants totaling well over $100 million to set up and start their own marketplace. And some of that is for marketing. They do their own marketing, they have their own navigators, and they're responsible for making sure they're trained and certified, same as everybody else. I'm not sure where the $97 million came from, and I think we'd have to have more information from the viewer.
In the age of the internet, many figures are available for many purposes.
So true.
Well, as we looked into the period building up to this Tuesday, of course, in state legislatures such as Wyoming, opposition to Obamacare has been most intense, basically in Republican states, including this one. Here is a soundbite just wanted to play from the chair of the Senate Health Committee at a recent hearing into the exchanges.
I worry about the state taking ownership of a federal disaster and misleading some of our people, because people will say, okay, I've got the insurance covered, and drop whatever they've got effective the 1st of January and could get in a lot of trouble if this federal thing doesn't work.
Disaster. I've heard other words such as train wreck. I'm wondering, Representative Coleman, you're there on the front line, during the hearings, and you hear, I'm sure, all of these comments and more. Why so vehement, the feelings?
Oh, I definitely think that there's, some party. There's politics in Obamacare. There absolutely is, and I think especially Senator Scott has a lot more experience than I do. Obviously, I'm a freshman, so I'm inheriting everything and all of the work that we've put into it thus far. But I do believe his comment, I don't want it to be taken out of context. What we were discussing at the time was whether or not we were going to take ownership over our own marketing and outreach plan. And what we were discussing was there were some funding, some grants available to us in letting us roll out this outreach and marketing program and these big PR campaigns. The problem that we had with that, and what I think Senator Scott was referring to, was you couldn't edit the message. So we basically were going to be waving pro-Obamacare flags around Wyoming and giving the impression that the entire state, the legislature, the Department of Health, all of your government officials were in support of this and endorsing it. And we definitely don't want to give that impression when we don't have answers to how this is going to work.
Well, I attended the first number of hearings way back, like a couple of years ago, before the legislature had passed a law to state you can't sign up for this. And even at that point, the presentation on the part of the state at those hearings was really just one side of it. It was very opposed to implementing what they called Obamacare. They didn't have representatives, who were supporting it. So it's always struck me that that in terms of where the state government is coming from, it has not wanted anything to do with this from day one.
We're a very conservative state. Wyoming has always been, and we're very proud of the fact that we're fiscally conservative and fiscally responsible. When you take a look at our budget and the financial picture of our state versus our country, Wyoming is doing, I think, a much better job. And this bill essentially costs a lot of money, and it's something that a lot of Republicans, and I'm a Republican obviously, we don't feel comfortable or feel good about participating in, and a lot of our constituents are telling us the same thing. And so, most of the Wyoming citizens, although I can't say I'm not opposed to the concept of better health care. I'm completely in support of the concept of better health care and providing more insurance. I think we have a huge problem with uninsured and underinsured. I do want those things to improve, but the option that's on the table before us, Obamacare, is, I believe, a disaster, a financial disaster. And I personally, and as a representative for my constituents, I don't want to volunteer us to make this problem any bigger. And this participation in this program is making that problem bigger. So I think there's probably a very responsible justification for why we feel that way as sound conservative Republicans in Wyoming.
Mike, anything to say to that?
Well, I'm not going to get involved in politics. I'm a career civil servant, and my job is to explain factually to people what this is going to mean to them. And frankly, I think we probably agree on most of what you said in terms of the biggest problem with American health care is there are too many people with no insurance, there are too many people who can't get insurance, and there are too many people who are underinsured. And those are the people for whom the marketplaces are primarily intended. All due respect to Senator Scott, we're not trying to supplant employer health insurance in any way. In fact, if you already have employer insurance, you can go to the marketplace and try to compare prices if you want to. You're welcome to do that, but you're not going to get any tax credits to reduce those premiums, which, as we discussed earlier, tend to be higher in Wyoming.
What about the argument, though, that this, in fact, is inducing employers to drop coverage? Walgreens, the drugstore chain, just recently made headlines with its decision to provide, I think, a certain amount of money for employees to go and shop for themselves, but they're not going to provide the plans anymore.
Only part-time employees. They can't do that to full-time employees, or they would have to pay probably millions, tens of millions, maybe even hundreds of millions of dollars in fines for not providing coverage to their full-time employees. To the extent they want to move their part-time employees over to the marketplace and maybe give them a stipend for doing so, that probably puts those employees in a better position than they are now.
Well, something that you said, Representative Coleman, about, you support, of course, the principle of I guess, universal coverage?
I don't know about universal coverage.
Okay. How far
Don't
would
get
you
me in
go?
big trouble there. But I do think I do think that the uninsured and underinsured and access to quality health care is a significant problem. And I think that it's for our...
But isn't this a solution? A solution?
I'm in concept, in theory, perhaps this is a solution, but there's so many setbacks. It's got a huge price tag on it, and it's got so many problems with the system, and implementing this entire Affordable Health Care Act has so many problems with it that I can't understand how this is going to be successful. I don't see the light at the end of the tunnel. I don't see rainbows and everybody's happy and this is going to be picture perfect health care. I think that it wasn't well thought out. I think that there are still a lot of unanswered questions. I think that the end results are still yet to be seen. And don't you think on a national level to take this initiative and move forward, that's pretty scary that you're going to say, let's do this without knowing what's going to happen.
Well, certainly every president since Truman has tried to do it. Let's hear from our navigators. Have you got any rainbow stories to share with us?
I don't have any rainbow stories.
You anticipate something?
I know that there's a big market out there for people that don't have insurance, and we're here to provide an unbiased assistance to those people. And I'm not going to get into politics, of course.
Somebody has to.
Well, it won't be me, thanks. Not here. But I'm just glad that we can provide a service.
That we can help people navigate this marketplace. Whether my opinions about the Affordable Care Act don't matter when it comes to helping people get on this type of insurance, because by the end of March 31st, they will be required to have it. And from my training and what I've learned, insurance companies will no longer be allowed to deny people health insurance because of pre-existing conditions, nor will they be allowed to drop people once they develop some severe illness when they need their insurance the most. And being a female is no longer a pre-existing condition. And to me, I feel like a lot of people can and hopefully will benefit from the marketplace.
I think what you mean by that is that you can't charge women more than men.
Right, and the fact
albeit
that
for different
women
procedures.
may need maternity care being a pre-existing condition.
Well, what
as well.
about this aspect of, I know some national politicians have alluded to this, that they're afraid that that the public will get hooked on Obamacare, that they'll get to like it too much, when you look at the different aspects, such as children up to the age of 26 being on their parents' insurance, or no pre-existing conditions for children already, and no pre-existing conditions for adults coming, I believe, in January.
Correct.
How would you then take that away from people if it gets through?
Well, you don't. You create an entitlement program. You don't take that away. It becomes, well, it becomes nearly impossible to take that away, so you don't take that away. Don't get me wrong, I think that there are definitely some areas, and I think including some of Wyoming's delegation has worked to try to find those improvements in areas and where this can work. And I think definitely one of the things that may have helped or could have been helpful or is possibly coming is taking it and breaking it down into smaller chunks and kind of rolling it out. And I think that's inevitably happening because you can't take such a big program and roll it all out at once. So we are having delays on certain aspects and certain parts of the programs. And so I think that will certainly help.
Of course, they did spend years building it up, writing those 1,200 pages or however many it
1,200
is.
is all.
Do you ever find yourself saying to fellow members of the committee, let's try to be a little more calm about this?
I actually don't speak a lot at committee, but I do find myself thinking as a freshman, there's a huge learning curve, so I do try to take as much in as I possibly can. I do believe that there must be a bigger history to how did we get where we're at, and how all of the work that everybody has put into this. Being on labor, health, and social services is a significant time commitment and a huge learning curve, especially for a freshman. We had 5 freshmen, I believe, on this committee on the House side, so there was a lot of work to be done. Our chair, both Representative Harvey on the House side and Chairman Scott on the Senate side, put a lot of effort into getting us educated. So I could see, if I'm doing this in 4 or 5 more years, how I may be that excited about the topic as well. So somebody may be telling me that I need to calm down a little bit, but it is, every once in a while, it gets pretty interesting on committee to just listen to the passion behind everyone's voices.
Clearly. Now, here's a question from Emily in Laramie, and I think this has been all too common a question for all too long. It's simply this: I do not qualify for Medicaid and can barely afford to pay tuition. How can I possibly pay for health insurance? And P.S. I'm too old for my parents' insurance. Is she playing out of luck?
Well, I think that's a big part of the problem. The navigators are going to have to reach out to these individuals and.
How much help? She says doesn't qualify for Medicaid. Is there some wiggle room?
In qualifying for Medicaid?
Oh no, it sounds like she's tuition. Can't afford to pay tuition.
Well, we don't have enough facts in her case to really answer her. But very simply put, assuming that if she is above the poverty level, which is about $11,500 for a single person, then she will get very substantial tax credits to help her afford the cost of insurance. She would probably be expected to pay 2% of her income. If she's making $12,000 a year, that's $1,000 a month. 2% of that is $20. a month. That's probably what it would cost her to get insurance.
Now, this could be a simple
It
question.
might be even less than that.
And it's from Ron in Laramie. Do we get to choose our own doctor?
Yes, the plans that you choose through the marketplace, you are allowed to choose, what kind of coverage that you want, and if you have a specific doctor or physician that you see, as long as their insurance company works with the hospital, you can keep your trusted physician or whomever you choose.
All right, well, while we're on that gig, we have Edna from Cheyenne who wants to know, she's self-employed, doesn't make enough to pay for an individual policy. Her daughter is on Medicaid now. Would she have to find a new provider for both of them? I guess that's along the same lines.
No, if you are insured right now, you do not need to find a new provider. But like the case of Emily and Laramie, I would need to know more about her situation and how much taxable income she makes a year to determine what her possibilities in the marketplace would be. But since she has a daughter who is on Medicaid, she probably would have pretty good opportunities through the marketplace.
Okay, just as a reminder for our viewers, we'll take your questions at 1-800-495-9788, or you could just email me at richard@wyomingpbs.org. You could also tweet us at #WyoHealth. Back to our viewers. We have Greg in Casper. He is a 100% qualified for medical. He's a retired Army. He works for a school and has excellent insurance in a private business. Now, does Obamacare require medical insurance for his private business? He does not have employees.
I believe the answer is no.
No, I was going to say if he has no employees
He
and
has
he
no
already has
employees to worry
insurance.
about. He's already got excellent insurance, and thank you for your service. I don't believe the gentleman has to worry about the marketplace in any way. He's well set, it seems to me, based on what what you've read.
So even though he's got a business, and let's say something were to happen at the business.
Well, but in effect, he's self-employed in his business. He has no employees. So for purposes of the marketplace, he's considered an individual. He doesn't have to worry about the small business operation in the marketplace. He's certainly not a large business, so those categories don't apply. And the description was he's got first-class insurance as a veteran. I would say he's pretty well set and doesn't need to worry about this in any way.
Well, continuing along that line, because of course the big part of the debate's been over the employer mandate. The mandate for large employers with more than 50 has been delayed for a year. You didn't have more than 50 employees, right? So
I did not have more than 50 full-time equivalents for the previous year.
okay, so that headache has been postponed for you then, has it?
Yes, but we're watching very closely what our full-time equivalents are.
Now, my understanding too is that there's another mandate that is incumbent upon employers, which is simply to get the information out.
Right, which was my understanding that we probably needed to do that now, but they delayed what is the penalty for not doing the notification?
That's a very good question,
Yeah.
to which I do not know the answer, honestly. Those rules come out of the Department of Labor, not from us.
In action, I think that,
And my understanding of what Labor did, and we did converse with them about this very topic a couple of times, is that the requirement for employers to notify their employees has not changed. However, I'm not aware of what, if any, penalty there might be for failure to notify. And just to clarify, since you have fewer than 50 full-time equivalents, you're not required to provide insurance for them at all, now, next year, or any other year.
Right.
So it's only if you cross that threshold and become
Right.
more than 50 FTE that you have to worry about it. And yes, you have to do the computations or have your accountant do them. That's part of running a business.
we had those figures released today on the costs of the average plan and what it's going to be in Wyoming. Of course, we're on average about the highest in the nation. So to what people can get for the bottom of the line bronze plans, the cheapest ones. Essentially, what would like a typical bronze plan be for a family of four, and roughly any idea how much that might cost?
You know, I am not sure. That really depends, again, on everybody's circumstances, your income, and things like that. I do know your premiums will be lower, but your deductibles might be a little bit higher in a bronze plan, and then it changes once you get up to a platinum. One thing about the marketplace, though, is I think a lot of people are afraid, but you do not have to commit to anything. You are allowed to go onto the marketplace, maybe create an application, say a username and a password, and shop around without committing to anything. If you have a first-class insurance plan, but you want to see if there might be something out there that's better for you, go and do that. Enter your information. Just see what could be out there and might be available to you. You do not have to commit to anything.
As a matter of fact, to that point that you just raised, this just came in from, it's from Tim in Newcastle. And his question is, I'm a self-employed small business owner, a yearly income of about $10,000. And he's gone on the cost calculator at healthcare.gov. And even the lowest bronze level of healthcare coverage, he says, would cost me 40% of my yearly income. And knowing that I cannot afford even the most basic level of healthcare, here comes the rhetorical question: how can you justify charging me a fee for not being able to afford health insurance? I guess that means the fine that he's talking about.
Based on the question, Tim, you don't have to worry about the fine or the penalty or the shared responsibility payment or whatever you want to call it. It doesn't make any difference. People, if your income is truly $10,000 a year, you're living below the poverty level. You do not have to buy insurance at all. You're exempt essentially from having to do that. You're exempt from any penalties for not doing it. The problem is the way the law was originally drafted contemplated people like Tim being included in Wyoming Medicaid. The law essentially meant all states had to bring in all people within its borders up to 138% of federal poverty level, in this case roughly $15,000 a year, would automatically go on to Wyoming Medicaid. That was the original intent until the Supreme Court ruled. The Supreme Court decided, no, you can't force the states to do that. It's up to the states to decide. And Wyoming has decided not to do so. What that means is that the coverage that Tim would have had, that would have been paid 100% by the federal government for the first 3 years, and then at least 90% by the federal government in perpetuity, doesn't exist at all.
I mean, Representative Coleman, not to put you on the spot too much, but do you feel bad for the people who are going to end up not being covered by this massive effort to extend coverage?
Sure I do. Our committee, not the Health Insurance Exchange Committee, but Labor, Health, and Social Services, we're taking a look at a couple of alternative options that does not include automatically extending or expanding our Medicaid. I think and I hope that the constituents of Wyoming can understand that for us to participate in an expansion of Medicaid at that level was making a considerable investment, and we were betting on the backing of the federal government to continue to fund that program.
Just to pick up on that point, because I heard that during the debate at the time, and I guess what occurred to me was we rely on the federal government to make its payments for all sorts of other things, whether it be the roughly $250 million in roads, and you can go on and on. What is it about the Medicaid expansion, which they had said they would cover 100% and then 90% after a few years, to
How are we doing as a country counting on those payments? What's happening to our national economy when we're counting on all of those payments and we're overextending ourselves and we're supporting more programs than we can possibly afford to support? So don't get me wrong, I think what our committee is doing is looking at alternatives to programs that are similar to the expansion of Medicaid that will still provide coverage to those with a little bit of a higher income but still can't afford insurance on their own, those that truly have a high need and those that truly probably need to be in that category. We're looking at alternatives that are not going to cost us as much, and they're not going to rely on the federal government's continued support in those programs. There was not a lot of faith, and like I said, I'm a freshman, so there's probably a bigger history when it comes to this too, but I can tell you that the debate on the floor and all the discussions that we had in committee on this subject was there was not a lot of faith in those federal payments in perpetuity to support this program at that level. And the federal support did go down after certain years.
That was part of the condition, but it was still going to stay at about
Right.
90%.
So on top of everywhere else where we're extending our federal budget, how are they going to do that to 50 states and continue to acquire debt? What's the big plan for paying that back, and how are we supporting that? Without any of the answers to those questions, it's really tough for us to say, that's great, we don't know where your money's coming
I sense
from.
a comment at the other end of the table.
Oh, no, I'm learning a lot sitting here as well.
Well, we've heard a lot about job loss, of course. That was another aspect of Obamacare. But some of those claims were looked into by Fact Check organization, and they didn't find they were valid, but instead they said that there was something called, it could change job lock. In other words, that's the phenomena where people feel they're locked into staying in a job because it's the only place where they can get coverage at any kind of reasonable rate. Do you expect, in the navigating that you're going to be doing, to be picking up on some of the people who now feel they have other options?
I definitely hope so. I mean, I definitely hope that me as a navigator, I'm utilized as much as possible. I hope that people come to me with questions and use this marketplace for what it isn't intended for people to be able to compare health plans and find something that best fits their budget and needs. So if they feel trapped, hopefully they can look at this as an outlet or a way to better the insurance that they could potentially obtain.
Here's a question from Gloria in Casper. Good to hear from Casper. If a person cannot afford health care coverage now and will have to buy health insurance and won't get tax credit until next year, how will that be handled?
That's one of the really impressive things about the way this bill was written. And I'll absolutely admit there are some things about the way this bill was written that are not impressive.
I'm going to toot a horn here, I think.
But unlike most tax credits, and that's what the question refers to, most of the time when you get a tax credit, you might accrue it in the course of a calendar year, and then you claim it the following April when you file your 1040 form. So you got to lay out the money, maybe you get some of it back in the form of an extra refund. That's not the way this works. These are called advance premium tax credits, and once they are computed in the marketplace system, you are allowed to take some or all of those credits up front on a monthly basis to reduce the amount of the check you write to the insurance company. For example, if you were the family of 4 with an income of $50,000 and the cost of a policy here in Wyoming was $1,200 a month, but your expected contribution was only $300 a month, and this is not far from reality, you get a $900 a month tax credit against the cost of that insurance. You can take it right away and then just write the insurance company a check for $300. At the end of the year, when you file your 1040, it all has to be reconciled so that the amount of income you actually have during the year is approximately equal to the amount you tell us on the application you were going to have, so that the tax credits are accurate. If they're not accurate and they're in your favor, you get an extra refund. If they're not accurate and they're in the government's favor, meaning you got too much of a tax credit, then yes, the IRS is going to want to have it back. But that's the way it works, so that the insurance, the object here is to have the insurance be affordable right at the start, so that ordinary middle-class families can write a check for the monthly premium that's a lot closer to being within their budget.
We have a comment. It's from Michael in Thermopolis. And Michael says he appreciates this discussion, but he truly wants Obamacare dumped. Quote, I'm disabled and pay for my own medical. Why should I be penalized for those who don't? A mandate is taxation without representation. Why am I looking at you?
I don't know. Why are you looking at me? I agree. You know, and I think Thermopolis, they also have a freshman representative this year, Nathan Winters. Representative Winters has got a sound head on his shoulders, and so I would believe that they probably have very good representation somewhere along the same lines whenever we're talking about these things in the state. But unfortunately, this is federal, so there's not a lot we can do, and everything we try to do seems to get overridden.
Well, perhaps more to the point, in Michael's case, if he is disabled and he's receiving disability payments from Social Security, he's automatically eligible for Medicare. And that means he doesn't have to worry about the marketplace. He's already got great insurance, and he actually has a government-run insurance program, not to be confused with the marketplace, where the government only operates the facilitation process.
Or perhaps he's unaware that he has some benefits that he could be eligible for.
That could be too. But the point I'm trying to make is that, you know, in the marketplace, this is not socialized medicine. This is not a government takeover of healthcare. What we are doing as HHS is creating the system in which people can compare the plans that are out there in the open market, provided by private insurance companies, and do some comparison shopping that they really never have been able to do before, and then get tax credits that help make those policies more affordable.
Well, in fact, to that point, there have been a number of attacks on Obamacare coming from conservative groups. We're going to show you just a part of one of those ads from Generation Opportunity. That's a conservative group funded by the Koch brothers.
Well, your vitals look good. Any changes in your diet or exercise? All right, can you swing on over, scoot on down, and try to make yourself comfortable? Okay, let's have a look.
I should mention this comes in his and hers versions as well. Good. Yeah, it's for equal opportunity misery or creepy kind of video. Well, your sense on who this is aimed at? Who do you think this is aimed at?
I think it's aimed at the average middle-class family, the average person that might be left feeling vulnerable to the healthcare situation. You know, I think one thing we want to dispel is the marketplace is created for those people, and I guess that's all I have to say on it.
It is, and you know, you shouldn't be afraid of it in a sense, you know, because like I said before, it's nothing that you have to commit to, or it's part of your life forever. If you go to healthcare.gov and decide to apply in the marketplace, it's a way for visits like that to be more affordable to people. I mean, as a woman going to a doctor for your yearly visit, that's something that you need to be covered, and because, you know, they can get expensive, and so the marketplace, people just need to look, you know, just search it, see what it has to offer you. It may not have anything, or it may have everything for you. It's not something that you should fear, in a sense.
You know, Representative Coleman, we talked earlier about the tone of the debate. And I'm wondering, you know, seeing that and the other version with snapped on the glove, if you know what you take from that, you know, is it just trying to scare people off, or?
I think that's probably a very accurate reflection of what a lot of conservative Republicans are. You don't even have to be a conservative Republican to fear that that's too much government intrusion in something that's a very private part of your life. Your health care is very private. So I understand the concept behind it. What we're trying to do is essentially a good thing, and that's to get more insurance and better health care and more quality and definitely more access health care to those individuals who need it the most, and definitely want things to be a little bit more fair for those who have a significant health condition and they were losing their insurance. But I don't think that outweighs the fact that this is significant government intrusion in the lives of everybody. It doesn't matter what party you are, but it's you know, a serious growth of government. And in Wyoming in particular, I know at least my constituents were not really fond of growing government, especially to the extent that they are in our doctor's office.
Mike,
The government is not in your doctor's office. This is a ridiculous scare tactic aimed at people who either don't understand what's going on with Marketplace or have chosen not to learn.
just in terms of it's all about winning the hearts and minds, as I've
Yes,
said
it
for
is.
many, many years. And did you get the sense this and pro-Obamacare ads as well are aimed at a younger cohort?
Yes, they are. And they're both aimed at that younger cohort for exactly the same reason. Younger Americans are really important to the success, or I suppose, the failure of the Affordable Care Act. Look, the whole point of insurance is to have everybody contribute into the pool to pay the catastrophic losses of a few. That's what insurance is. Doesn't matter if it's your car or your house or your health care. The problem we have in this country is that a lot of the people who don't pay in right now are the sickest people. They can't even get insurance because the insurance companies have been allowed to exclude them, or they're too poor to be able to afford it. So we change that, and we get everyone in the pool, including healthy younger adults, and we have a much stronger system with less uncompensated care by the hospitals, less tax support for providers like hospitals from the government and the states, the taxpayers, and we have more preventive services so that we're a healthier country. That's the object here.
We have another question from Brenda in Casper. And she says in June she retired from her company and they gave her options for insurance. Her premium is $964 a month. She has lots of health issues, is living on a 401k. Under the new plan, will she be able to reduce the cost of health insurance, do you think? I know you don't have all the figures.
I don't think we can really opine on that. It depends on how much money she's taking out of her 401k, because that's income. To the extent she can control her income, right? So if she is careful about how much she takes out and stays under the limit, she will be eligible for tax credits to reduce the cost of insurance. But $900 a month, I'm not sure what that is. Is that COBRA insurance? Is that her retiree insurance? It's certainly not Medicare. We need more information, like we usually do.
If she can get that information, that she could call. Is there any central number for navigators?
Actually, yes. We've got a 1-800 number. It's 1-800-856-4398.
Okay, we will put that up on our website as
Okay.
well. Yeah. Another question from Rita in Cheyenne. And it's, what about seniors who pay $100 a month for their Medicare? Do they have to buy a separate policy under Obamacare?
I'm so glad you asked that question. Thank you for asking that question. The answer is no. People who are on Medicare do not need to worry about Marketplace plans, costs, premiums, or anything else. This is not for people with Medicare. You already have really good insurance, and you're paying a relatively small amount of money for it. The only question about an extra policy would be whether or not you wanted a Medicare supplemental insurance policy, which you are able to get without any restrictions only in the first 6 months after you enroll in Medicare Part B. But beyond that, really, this Marketplace discussion does not have anything to do with, nor does it make any changes in your Medicare.
Now, I have another question. This is a good one for Carla. And that is, it's from Jane in Cheyenne. And she says, if I have Medicare, do I have to see anyone, or do I need to sign up for something? In other words, what do I need to do?
Absolutely not. If she's on Medicare, she doesn't have to do anything, as Mike just stated.
So essentially, to reiterate, essentially these marketplaces are for those who are uninsured and who therefore do not have a policy. Like I said, about a third of people are covered by various government plans, half through employers, so they can go watch Downton Abbey.
It's a little more than that, I think, Richard. there's about 16, 17%, as I recall, of the people in Wyoming have no insurance. And then another 8 or 9% buy their own policies in the open market through a broker or an agent. So we're really talking about something on the order of a quarter of all people in the state who either don't have insurance or are usually paying through the nose for their own policies. And those are the people the marketplace is expressly designed to help.
We have a comment and question, all in one, from Ron in Laramie. And what he says is, how can you call my son being on my insurance until he's 26 an entitlement? I think you're the only one who's sort of promoting that as an entitlement.
Well, I just meant on a much bigger picture, saying that if we're providing this benefit, if that's a better word for it, a benefit, and that once we provide it, if we try to take it away, I think the mindset is that it then becomes an entitlement. So we've provided these benefits for so long. If you take them away, then that would be unjust. And I agree with that. I think it would be unjust. If you provide it, it's very difficult to take it away. So that is why, especially all of the bills that we see coming through our Committee on Labor, Health, and Social Services, we have to try to be very careful about if we're creating an entitlement and or a benefit that we may possibly have to take away in the future, because that is unfair. We try not to do that. So I don't want him to think that I am saying entitlement as if that's something that's negative, more of a benefit.
Just following up on that, there are so many elements that people can endorse. What parts of Obamacare would you like to see sticking around, even if the plan were to go away?
I like the concept. I especially like the navigators. I don't think that they received enough funding. So there's a Republican saying they weren't funded enough. We got a very small pool of money. I did take a look at those grants, and when you start adding in your travel time, you guys are very limited in what you have to do. There's got to be some volunteer time in there.
And that is going to be the last word for now. But there is so much more to be said over the coming months or years while our healthcare marketplace continues to evolve. I'm Richard Ager, so thanks for taking part in this Wyoming Perspectives.